The impetus for this lecture came from when I was watching the Today Show some time ago. And Dr. Nancy Snyderman had a program on Alzheimer's disease where she presented all of the horror stories of Alzheimer's disease, how to diagnose it, the PET scans, all that we can do to diagnose it, and showed all the terrible, tragic loss of life and the suffering of the families. And then it ended. And I went, wait a minute. It's like an Alfred Hitchcock movie. What happened? There was no ending to it. Well, what about how do we prevent this? Is there something we can do for it? Well, unfortunately, according to her, there was not. In 2010, Alzheimer's disease was the underlying cause of 83,000 deaths and a contributing cause of another 26,000 deaths, making the illness the sixth leading cause of death in the United States and the fifth leading cause for people aged 65 years of age or over. As Alzheimer's disease mortality increased, the mortality of these other things that we normally see decreased because people are dying of Alzheimer's disease instead of these other problems. The estimated cost of health care for people with Alzheimer's disease and other types of dementia is $200 billion in 2012 and expected to reach $1.1 trillion by the year 2050. End of story. Well, no, it's not the end of the story. So what can we do to prevent deterioration of the brain? There's a couple different processes that cause deterioration of the brain, and I would like to go through a medical literature review. This is a journal club. Review of what the literature tells us and shows us. I did invite Dr. Snyderman to this lecture, but I never heard from her. But nevertheless, it's extremely important information that we should also all glean from what our literature shows us and tries to teach us. And we should look at that literature and help ourselves as well as our patients based on that literature and the scientific review. Estrogen is beneficial for both sexes, for both men and for women. Physicians typically remain unaware of the fact that estradiol and progesterone, the natural hormones that we lose as we get older, have tremendous beneficial protective effects on the brain. They also have other functions other than related to menopausal symptoms, but they have a tremendous beneficial effect in protecting us against the diseases of aging. Postmenopausal estrogen loss is of great importance for the brain, and it's a 17-beta estradiol that's greatly unappreciated because of the effects that it has on neural growth and trophic factors and maintaining optimal brain function, shall we say. Estrogen has been shown in the brain to have very important influences on the development, survival, plasticity, aging of neurons. There's so many different studies looking at so many different effects of how estrogen helps protect the brain. It's just phenomenal. Alzheimer's disease is largely a disorder of old age, yet factors influence this risk years before the disease actually can be seen. And that's when we really want to attack this. Is not when we suddenly get it, oops, you've got it, well, that's too bad, but maybe 20 years before we get it in the whole entire population so that we don't see this terrible disease as we get older. There's increasing consensus that interventions to reduce the burden of Alzheimer's disease will be more successful if implemented early rather than late. Once you get it, you're stuck with it. Although later in this talk I'll show you that there are some things that we can do when you are stuck with it that have been shown to be beneficial as per our science. Estrogens are widely believed to influence Alzheimer's disease risk in women and in men, as we'll see. Findings suggest that the effects may depend on timing. And it's the timing when women lose their estrogen, when they become estrogen deprived, that when we want to start the estrogen, not 15 or 20 years later, once the harmful effects have already taken place. There's two things you need to understand about estrogen and dementia. There's two different processes in the brain that affect dementia. One is Alzheimer's disease, which is a deposition of beta amyloid protein. And the other one is a vascular dementia, where we have lack of blood flow to the neurons in the brain because of cerebral vascular disease. They're two different processes, but they're commonly lumped together as dementia. In the Women's Health Initiative mental status study, which was restricted to older women, what we discovered was the risk of dementia doubled in older women that started hormones, which gives everyone fear of taking estrogen or hormones because of that study. Nevertheless, that was an older population that had never taken hormones before, and they took hormones that we know cause plaque rupture in the brain and in the heart, and guess what? They got an increase in dementia that was significant. However, Originally, it was claimed to be Alzheimer's disease. It really was not. It was a dementia. And Alzheimer's disease, there were so few cases that it really wasn't reported as a separate entity. It was sort of lumped together along with the vascular dementia. But so frequently, the vascular dementia is called Alzheimer's disease, and it really should not be. Before the Women's Health Initiative study, there was a robust observational literature that suggested significant protective effects of estrogen against Alzheimer's disease. Hormone therapy and Alzheimer's disease later in life may not be the best thing because of that plaque rupture that you can get later in life, but there's a significant amount of data that the meta-analysis estimated a significant risk of reduction of Alzheimer's disease by 1/3, a significant decrease. But where was Dr. Snyderman with this? The Cache County study that's so frequently quoted but so frequently forgot, published in JAMA years ago, used hormone replacement therapy, and they found a 2/3 reduction in the risk of Alzheimer's disease. What is it that we do not understand about this study? Why do we ignore it? Well, the Women's Health Initiative showed an increase in dementia. That's vascular dementia. It's not Alzheimer's disease. It's two completely separate processes and pathologies. And what the study showed that women who initiated therapy within 5 years of menopause had a 30% lower incidence of Alzheimer's disease, a hazard ratio relative risk of 0.7. In contrast, the risk was unaltered amongst hormone users who began treatment more than 5 years after menopause. Don't wait until it's too late. Take it early. Don't become estrogen deprived for 10 years and then try to take it and then think it's going to reverse those problems, and it will not. It needs to be started early and continued indefinitely. There was another Alzheimer's study that looked at the interaction with hormones and Alzheimer's disease. Hormone therapy was associated with a reduced risk in the younger but not the older women. It does not help once you develop that beta amyloid protein plaque on your neurons, but you can certainly protect against that, and that's what really this should be. The name of my clinic is Preventive Medicine Clinic, and that's what I do. Don't wait until we get it and then go, okay, well, there's nothing that we can do. Even in the Kaiser Permanente study, those women that took estrogen were found to have a decreased incidence of Alzheimer's disease, but those that waited until later, 10 years or more beyond that, actually reported an increase 48%. Well, that was, again, a vascular dementia, not necessarily an Alzheimer's disease, but they're commonly lumped together. Alzheimer's disease and coronary artery disease have a shared common risk, and that has to do with loss of estrogen. In the WHI trial, women assigned to hormone therapy close to menopause had a reduced risk of coronary artery disease, and they also had a reduced risk of stroke. It's when you're beyond that 10-year window that you tended to have the problem. And it's the premature loss of estrogen that increases the dementia risk, whether it be Alzheimer's or whether it be due to a vascular dementia, which is the same pathology that we see with heart disease. Estrogen has been shown to prolong life. It also protects our brain in all of these studies and ameliorates this risk, as we saw in the Cache County study and every subsequent study after that, protecting against Alzheimer's disease. But you have to start it within that 10-year window in order to be protective, and it certainly reduces it in every study to date.